So good morning, and this is your GI simulation pre-brief video recording. So you will be coming this next week, either Wednesday or Thursday, for your GI simulation. So first of all, let me apologize for my voice. I think it's just allergies, but I'm sure it will be a little bit aggravating listening to me this way, so I'll try to clear it up the best that I can. Just a reminder that the academic integrity policy still applies. So do not discuss this simulation with anybody else. Once the simulation is done, you can discuss it with your peers as far as for studying purposes. It will be done Thursday afternoon at 4 o'clock. So after that point, you can discuss it. There may be video recording. We do delete those recordings typically within the 2 weeks after your simulation. And just so you know, we do record it so that way we can play it back and help in the learning process if we need to. So the plan is that pre-brief will be around roughly 15 minutes. Your actual simulation will be around 30. And then hopefully we will have roughly an hour and 15 minutes for debrief. That's the goal. You will get orientation to the room and everything as you normally do. Objectives. So the objectives, and there is a protocol, TPN protocol, that is posted under simulation documents under elimination simulation folder. The first objective is to demonstrate a focused GI assessment. So think about, when you're thinking about that, think about your bowel sounds. Bowel movements. Think about constipation versus diarrhea. Are they having constipation? Remember the time frame to say as far as if there are no bowel sounds. So you were taught that in 111. Think about that as well. The second objective was to demonstrate post-op interventions in a client with acute diverticulitis who underwent a surgical resection. So things that you need to think about. You think about wound care. Okay, they're probably going to have a wound. You need to think about signs and symptoms of infection. Ambulation. Interventions to prevent DVT. Nutrition. Diet. TPN, lipids. See that protocol that's posted. Nausea, vomiting, pain assessment. They might have an NG tube. You need to think about NG tube and care. The other objective is rights of medication administration. And I know that you should know that by now, but if you need to review that, make sure. So there will be medication administration. Appropriate wound care for an open surgical incision. So you'll bring this back to 111. Think about the different wounds you had in that lab and how you provided appropriate care and dressing changes. So make sure you think about wound care. Again, signs and symptoms of infection of the wound and how you will need to do that dressing. General code of conduct, be prepared. Make sure that you complete the pre-work, which means watching this video, doing your readings. If there is a ticket, which I'm not 100% sure, but I'm thinking there may be a ticket to class related to this information, it needs to be completed before simulation. Whenever it is assigned in the class is when the due date is. Be on time, be fully engaged. When you come in, have your computer, I prefer closed during pre-brief. You don't need to be looking at anything until we get done with pre-brief. So make sure that your computer is closed during pre-brief, and in debrief, you're not looking at your computer either. Be fully engaged. We expect you to be fully participating in both pre-brief and debrief and the sim. Make sure you're in your clinical attire. There will be a simulation survey after this, and make sure that you do complete it. It is required computer work. So this patient is our nursing and mannequin. So I want you to suspend disbelief. Remember that fictional contract you signed. Treat that patient just as real as possible, no pretending. We will tell you if the patient is moving. You can run IV fluids through nursing in. Head wall for oxygen and medical air works, suction works. Nursing in has all of the pulses that you have. She has her carotids, her brachial, her femoral, her popliteal, her pedal, her radial. She has all of her pulses, but you do have to hold for 20 seconds with her before you can say that there is no pulse. So remember that. You'll hear lung sounds on front and back with her, same places that you listen on a real person. She has it. And she does have bilateral chest rise and fall. The only thing that is not as real for her is that her pupils do not react. So if you check her pupils, if you don't hear anything, that means that everything's within normal limits and that it is normal. Remember, this is a safe environment. This is not a test. This is just for us to learn from. So remember that when you go into this simulation. The roles, very briefly: primary role, assessment, delegator, call to the healthcare provider, communication with the team. Secondary nurse is the medication nurse, typically, as far as getting medications and other duties that are delegated from the primary nurse. Resource, I want to go over this just a little bit more because you had not had resource until this peri-op inflammation sim, but the resource can be a med nurse if needed. I feel like there's maybe confusion over this. The resource nurse could be doing medications as well. They can do whatever. They can do anything that a nurse can. Wherever you need the resource, you put them. So I just wanted to remind everybody of that. They are the go-getter and look things up, but they can be pulled into whatever need that you need at the moment. So remember that. Recorder. In the EHR, probably the main areas that you will document in is the notes section, vital signs, probably the assessment section as well. So you might want to look over your EHR, make sure you're familiar with where to document. And remember, you're documenting professionally and legally, as far as if someone was to come back in a couple of years and look at your documentation, would it be professional and would it be able to hold up in a court of law? The recorder is only to talk to the assistant recorder. They are not to be communicating to the other active people, only if it's relevant to documentation. Assistant recorder is the one with the paper who's writing down just kind of a log of everything that is occurring. Their documentation does not have to be so professional because the recorder is going to transfer all that into a professional manner. Observers. Observers will be assessment and priorities, clinical reasoning and interventions, teamwork, pharmacological interventions, and safety and infection. These are also, just so you're aware, these come from the NCLEX test plan. And so that's why we focus on these particular areas that get you ready for the NCLEX as well. Reminder, for the active participants, you can huddle. Don't struggle, huddle. Please, if something's going on, stop and huddle. If you need to reset. Okay, so I think that is it. Make sure that you review those documents, one document, the protocol and the objectives that are under simulation documents. Best way to prepare for this simulation is to make sure that you're looking at those objectives and that you can answer those objectives to the most fullest extent, and that will get you prepared for this simulation. Also, a reminder that the EHR is going to have not as much information as you have had in the past. So don't be caught off guard when you look in there and you don't see labs, you don't see vital signs. We're trying to get you prepared for real life. So we just want to let you know that. Thank you and have a good day.